Imagine a doctor tells you this: you have cancer, but we can completely remove the tumor and it may never come back. There will be pain, there will be fear, but you will accept it because it's good for you. Now think about this. Global Health Organization says that 30 to 50% of cancers are preventable simply by changing certain daily habits without any surgery or without any medicines. Isn't that worth considering? Hi everyone, welcome to 2026. I am Dr. PriyaRavi, PhD. In this video, I will share 6 science backed habits you need to cut based on major modifiable risk factors that are highlighted in the Global Cancer Facts and Figures report. Tobacco. The most powerful habit to cut is tobacco. And tobacco is the single largest preventable cause of cancer. This includes smoking, smokeless tobacco, and secondhand smoke. Smoking means cigarettes, bidis, hookah, and smokeless tobacco like gutka, kaini, zarda, pan with tobacco, mawa, and so on. And secondhand smoke, also called passive smoking. Now, here is the India specific reality. Over 24 crore people in India use smokeless tobacco, putting them at serious risk of cancer. In India, approximately 50% of oral cancers are attributed to smokeless tobacco, amounting to approximately 35,000 new cases per year. And products like kine contain extremely high levels of NNN, a cancer causing chemical, which is 10 to 50 times higher than the similar products that were sold in US or Europe. So, this combination of high prevalence and high carcinogen levels is why India has one of the highest oral cancer rates in the world. And globally, 26% of all cancer deaths are due to tobacco, according to American Cancer Society. And tobacco causes 2.6 million cancer deaths each year across 14 cancer types, like lung, esophagus, stomach, colorectal being on the top. What does all this mean? This means quitting tobacco reduces cancer risk dramatically, and smokers who stop around age 50 avoid more than 50% of excess mortality, including lung and other tobacco related cancers. And stopping earlier, like around 40 years of age, avoids most tobacco related cancer risk. So, in this new year, that is 2026, make it a tobacco free year. Decide today to quit. Remove all tobacco products from home. When cravings hit, drink water, chew fennel or herbal gum, or go for a walk. Inform family and friends and ask for support and cut this habit. And the second habit to cut is unhealthy diet. Food can quietly protect us, but food can also quietly increase cancer risk if it's not balanced. According to American Cancer Society, about 6% of global cancer deaths are linked to poor diet. Why? Because food is low in fiber, vitamins, antioxidants, high in processed and red meats, fried foods, sugary drinks, and salt. And also, we practice some harmful cooking methods like high temperature frying. So these all produce carcinogens, reduce detox capacity, increase oxidative stress, and weakens our overall immunity. And they're also linked to colorectal cancer, stomach cancer, liver, esophageal, and other digestive cancers. So from day one of 2026, plan your meals. Add more fruits, vegetables, whole grains, legumes, fiber, and reduce red and processed meat intake. Cut fried foods, sugary drinks, and excess salt. Also, prefer steaming, boiling, salting over deep frying. And the third habit to cut is alcohol consumption. Alcohol contributes to about 5% of global cancer deaths because alcohol converts into acetaldehyde, a known carcinogen that damages DNA and interferes with cell repair. It increases risk of cancers like mouth and throat, esophagus, liver, colorectal, and breast cancer in postmenopause women. So, in 2026, choose 5 to 6 alcohol free days per week. Track your drinking honestly and replace evening drinks with herbal tea or fruit juice. And avoid social triggers and remember your health goals. High body weight and inactivity together contributes to about 5% of global cancer deaths because excess fat, especially around the abdomen, produces hormones like estrogen, growth factors like insulin and insulin like growth factors, and chronic inflammation. All of these promote abnormal cell growth. And cancers linked to this are breast cancer postmenopause, colorectal, liver, kidney, pancreatic, endometrial, and many more. So for this 2026, have a goal to have 30 minutes of brisk walking or yoga daily. Replace 1 to 2 meals per week with millets, vegetables, and legumes. Track weight monthly. Small steps, steady progress. So, consistency matters more than perfection. And the fifth habit is environmental pollution and carcinogenic exposure. Yes, environmental pollution contributes to about 7% of global cancer deaths, which includes air pollution of approximately 4% and occupational or environmental toxins of approximately 3%. Pollutants in air, water, and soil that damage DNA cause inflammation and oxidative stress. Most commonly linked to lung cancer, also bladder, liver, kidney cancers, depending on exposure. So in 2026, keep windows closed on high pollution days. Use indoor plants or air filters. Avoid burning waste. And wash fruits and vegetables thoroughly. Use clean water. And avoid long exposure in heavy traffic zones. And the sixth and the last habit is infection related cancer risks. Globally, human papillomavirus causes about 730,000 cancer cases every year. That is around 3.8% of all cancers. This includes 100% of cervical cancers, 88% of anal cancers, 78% of vaginal cancers, 53% of penile cancers, and 31% of oropharyngeal cancers. India alone accounts for 20% of HPV related cancers, that is about 147,000 cases, with 84% being cervical cancers. And additionally, hepatitis B causes 54% of liver cancers and hepatitis C causes 24%. So, infections can integrate into cells, cause mutations, and trigger chronic inflammation. Preventions include vaccination with HPV and hepatitis B, safe sexual practices, regular screening, pap smear, HPV and hepatitis test, early detection and treatment. Please talk to a health professional and spread awareness. So, these are all the modifiable risks that we can modify and overcome them. But there are also non modifiable risk factors in cancer, and some of them are age, genetics, family history, gender, race, and certain unavoidable exposures. We cannot change them, but we can change the modifiable risks that we have heard now because 30 to 50% of cancers are preventable just by changing these lifestyle habits. So, when so much is in your hands, why don't you do that? So, as we step into 2026, remember this. We may not control our genetics, age, or past, but we can control our habits. Choose even one habit to change this year. Choose awareness, choose prevention, and choose life. Let 2026 be the year we take responsibility, care for our bodies, protect our families, and honor the life God has given us. Wishing you a healthy, hopeful, and powerful 2026. Due to time limits, I have shared only the most essential points here in this video. Behind this lies extensive scientific research. If you're curious or have a science background, I highly encourage you going through the PDF link below in the description to the American Cancer Society's Global Cancer Facts and Figures 5th edition. It will give deeper insights. In my next video, I will explain early warning signs of cancer and why early detection saves lives. Please like, share, and subscribe because knowledge has value only when it is shared. Thank you.